Growing up, I grew up with a cousin, an older cousin, who was somebody we looked up to very much. And unfortunately, he was taken away from us at the evil hands of cancer, and that left a lasting impression. He died a young man, and then I subsequently have had other family members affected. As I went through medical school, I actually toyed with a lot of different specialties, including gastroenterology, which I almost took. And appropriately at the last minute, I really chose my heart, and my heart said, no, I have to go for oncology, and I'm glad, I really am glad. There are days that are absolutely frustrating, maddening, depressing, but then there are also days that are absolutely sweet and victorious, and you redeem it in small measures. You redeem it in measures of giving somebody meaningful month or sometimes 10 years, but it is extremely gratifying. This is still a scourge of humanity. We are still far from completely eradicating it, but we've made amazingly great progress, I think, and tangible. 15 years I've been doing it, and very tangible progress, I can absolutely say. My mother is a survivor, and in fact she was treated at our cancer center when I first started, and this is 15 years for her, and it's I don't speak publicly about it much, but she has been one of those that I can say truly treatments made a huge difference in her life. Without compassion, there is nothing else matters, and without competence, you're really not able to help people. So you really need both. You need the cutting edge tools, technology, and yet you have to have the heart to know what they're feeling, the pain. So I think I speak from the point of being a family member to several cancer survivors and people who fought cancer very valiantly, and hopefully we provide them with very excellent, competent, compassionate care. When you've seen patients who you know were going to die, you absolutely knew that. I have a lady who's had a very rare form of cancer known as Merkel cell. She had failed, she had been under treatment for 5 years, multiple lines of chemotherapy, radiation, surgery, you name it, everything known to book. So at the very last go, the cancer had failed all of that. And we were gonna basically say we don't have any other options till we saw an article about immune therapy helping people with Merkel cell cancers. And we put her on one of the immune therapy drugs, which was not even approved. This is almost 3 years ago. And she had a miraculous response. She's alive and well today. Amazing quality of life, comes, sees me every few months. And so I was a convert right then. And then that story has been repeated many times over. A vast majority of people we would have lost previously have responded to this amazing new line of therapy. So we need more therapies like immune therapy. But that was definitely a huge advance. So those are the stories that really give us a lot of heart to say, keep the fight on, because we're making progress. So it's little chink, we keep attacking that weakness and go after the cancer as much as we can. So there are hundreds of these stories really that I can share, but these are some of the few ones that come to mind.